Hello and welcome. My name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're so glad that you've joined us today for the Song Brown not primary care, sorry, Song Brown Physician Assistant and Family Nurse Practitioner and Nurse Midwifery Technical Assistance webinar. That is a mouthful. We're glad that you've joined us today. I want to make sure that you're in the right webinar, so let's go to the next slide, who this webinar is for. This is for new and continuing applicants to the Song Brown Family Nurse Practitioner, Physician Assistant, and Certified Nurse Midwifery programs. The FNP, PA, and CNM programs, as we call them, provide grant opportunities that will result in funding for organizations to educate and train primary care providers to work in underserved communities. And of course, Song Brown is administered at the state level by HCAI. All right, let's take a look at the agenda for today. We're going to start off with a little bit of housekeeping and introduction right now with me. From there, we're going to move on to an FNP, PA, and CNM program updates, application process, and requirements, and we will have our program officers join us for that. And then at the end of this webinar, we're going to have time for some question and answers for you all. Let's go over the housekeeping. This webinar is hosted in Microsoft Teams. If this is an unfamiliar platform for you, you can find the chat and the view controls in the menu bar at the top of your screens. That chat option is particularly important because during the Q&A session, we're going to open it up for you to ask your questions. So you want to make sure that you're able to find that. And then lastly, this webinar is being recorded and will be available on our website within 7 to 10 business days. And with that, I am pleased to introduce Charles Fost, Program Officer for the Song Brown FNP PA program, to get us started. Charles.
Good morning. I am Charles Fost. The Song Brown program provides funding to education programs, including family nurse practitioner, physician's assistant, registered nurse, primary care residency, and midwifery programs. Song Brown statutory priorities include graduating individuals who practice in medically underserved areas, enrolling members of underrepresented groups in medicine, locating programs' main training sites in medically underserved areas, and operating a main training site in which most of the patients are Medi-Cal recipients. The EAP registration is open year-round. The applications for FNP and PA, as well as CNM, are open now and have been since August 12th. If you want to take advantage of our early submission option and have HCAI staff review your application to ensure it is complete, it needs to be submitted before 3 p.m. on September 9th. The absolute deadline for FNP, PA, and CNM application submission is 3 p.m. on September 24th. Everything opens and closes at 3 p.m. HCAI doesn't change grant applications for applicants. Please ensure that your program has approval to enter into an agreement with HCAI before applying. Song Brown funds must be used for the direct education and training of students and to help expand primary care services in California. They are not to be used to supplant other governmental funds. For the 2025 cycle, Song Brown programs are no longer taking the data pertaining to URM students and graduates into consideration for scoring. HCAI will only be collecting this data. HCAI needs information to pay your program if they are awarded. Any information that you think we might need to pay your organization is information that you should have ready when you apply. We suggest having open communication with your accounting department and whomever handles grants as you fill out your application. Your information needs to match your IRS reporting. You will need to know who will be signing all forms and contracts. You will need to know information about the training sites that your program uses. For instance, the payer mix information for each training site ends up being 1/3 of the score for application, and you should know this information before you start applying. Know your graduates, especially their NPI numbers. Many programs find it difficult to find their grads' NPI numbers and where their grads are now practicing. Gather that information before applying. Accreditation or approval letters are required when submitting your application. Expanding CNM programs need their letter indicating the number of approved expansion slots they are allowed to have. HCAI has the FNP and PA Grant Guide, CNM Grant Guide, Technical Assistance Guide, and Song Brown Glossary live on the website right now. The recording for this webinar will also be available on the website and on YouTube. The links to these resources are also in the chat. The next few slides we're going to be looking at are for the EAP, registering to apply, and general tips and rules for registration and applying for grants. Please use Google Chrome or Microsoft Edge. Other browsers, such as Internet Explorer, are no longer supported. If you haven't already, register as soon as possible. If you haven't applied in a while, make sure you still have access. If you haven't applied before, you will need to go through a two-step verification. If you haven't applied in a while, you might need to go through the same two-step verification that a new program does. You'll receive an email to authenticate your information. All Song Brown applicants must be listed as an organization for their type. Look for your organization in the search region next to the magnifying glass before requesting to be a new organization. Just be sure you are not already in our system. If you are a new organization, it might take time to get approved. If you are a new organization applying for HCAI grants, you'll need your organization name and address. Approving a new organization can take up to 5 days. It is necessary to make sure all information on this page is correct before you submit. This is our main way of contacting you, especially if we need to contact you by email. You'll need to request to have a program director role, otherwise you will only have access to the permissions of a grant preparer. Only program directors can start and submit applications. You'll need to email songbrown@hcai.ca.gov to request to be listed as a program director and have access to initiate and submit applications. If you are a returning applicant but a new program director, please reach out to us before you start applying to make sure you have proper permissions to initiate and submit an application. Those with program director permissions can give access to grant preparers to applications that they have already initiated, but only the program director can submit the application. To apply for any Song Brown grant, you click on the Apply Here tab and a new page will open. On that page, you will find the grant cycle you are wanting to apply for. In this case, if you're applying for either FNP, PA, or CNM grants, you'll have a unique thing to click on. For the Song Brown Family Nurse Practitioner grant, you're going to click on Song Brown Family Nurse Practitioner and Physician's Assistant 2025. If you're applying for a CNM grant, you'll be clicking on Song Brown Certified Nurse Midwifery 2025. We're going to go over some of the helpful tips for EAP and applications. There are two buttons you will see on every page in your application, the Save and Next button and the Previous button. These are the only ways to navigate through your application. The only way to save the application is to click Save and Next. The only way to go back to the previous page is to keep clicking the previous button until you get to the page you need. If you need to exit and come back to your application to finish it, your saved application will be on the Grants Applications page. If you see a red asterisk next to a field, that indicates that this region must be filled before you can move on. The blue circle with a white question mark indicates that there is a tooltip available. These will provide you with more information about what is being asked for or what you need to do in that region. The FNP and PA and CNM applications have the same general layout with two key differences. We will expand on those two differences after we walk through the application process. Some of this information will be pre-populated from your profile. It is important to have your profile information set up correctly. If the information on this page is not correct, you will need to fix it in your profile, not on this page. After you make changes in your profile, it will change what this page is populated with. Some applicants will have both FNP and PA programs. You are allowed to apply for both, but will need to have two separate applications. You can only apply for either FNP or PA on a single application. Look for your training program using the magnifying glass and only select training program not listed if your program is not in the system already. To complete the contract administration page, it is important to have access to your IRS forms. This page must match your IRS forms. If you are an organization that doesn't have a doing business as name, then do not enter any information in the DBA name region. If you do have a doing business as, make sure this region matches what you have reported to the IRS. Partner with whom manages grants with your organization and also with your accounting department. This is what we use to write your grant agreements, and this information is pulled directly from here, from this page, for what we put in your grant agreement. If your grant agreement signatory is the same as your STD 204 signatory, select yes. If it is not, make sure that all the information you enter here is accurate, as this is used by HCAI to send a grant agreement via DocuSign if you are awarded. On this page, we are asking for what the address the organization uses with the IRS and should match your W-9. If you are requesting to have payments mailed to an address that doesn't match your W-9, check the box yes at the bottom of the page. This page gives you the opportunity to describe how your program aligns with the mission of the Song Brown program. We also would like you to explain how Song Brown grant funds will benefit the direct training and education of your program students. You only have 2,500 characters, not 2,500 words. If you're going to copy and paste, this is from a different program. Please proofread after you paste it and make sure that nothing was cut off or misplaced during the paste. If you have 23-24 or 22-23 graduates, select Student and Graduate Data. Only select Student Data only if you have no 23-24 or 22-23 graduates. The gap year for this application is 24-25, so we do not ask for information about 24-25 graduates. Training site data accounts for 2/3 of the score for FNP, PA, and CNM applications. Have all this information ready ahead of time. It might take time for you to accumulate all this. We only want to know about the 5 most utilized primary care training sites where your students cumulatively put in the most training hours. To add a site, click the Add a Site button. Use the Options drop-down to review, edit, or delete training sites. This is the training site entry form that will pop up when you are adding a site. The information required for each training site is the training site name, facility type, NPI number, address, cumulative hours spent by your students, and payer mix for each site. There are links to the HCAI geolocator in the More Information dropdown to search for facility type, as well as a link to the NPI registry. To gather payer mix information, you're going to need to reach out to the administrative office of each of the training sites. Do not request more slots than your crediting body allows you to have. This page is asking for total program expenditures, not just what you would be spending Song Brown funds on. This is for the entire academic year 24-25, all of the program's expenditures. This information is only for data collection purposes and is only aggregate data. We do not need student names. We're looking for a total enrollment capacity for all cohorts to be equal to or greater than the total number of students enrolled. The total number of students that applied should be equal to or greater than the total number of students enrolled. This information is also for data collection purposes only, and we only need aggregate data. We do not need the student names. The totals here must match the total enrollment from the previous slide. The information that you enter for the number of graduates in each of the years that you had graduates will need to match the number of graduates that you add in the bottom region. Adding graduates will need to be done one at a time. Select the Add a Graduate button to add a graduate. Select the drop-down to review, edit, and delete graduates. For instance, if you have 5 total 22-23 graduates and 7 total 23-24, you'll have to add the information for 12 total students. This slide shows the pop-up for when you select Add a Graduate. Only graduates that are practicing medicine in California are scored. If the graduate you are entering is practicing medicine outside of the state, select No for Do you know the graduate practice site. The NPI we are asking about here is the graduate's NPI, not the facility's NPI. This page is where you'll be uploading your most recent accreditation or approval letter, which is required for all applications. The correspondence upload is not necessary unless you need HCAI to know something about your accreditation or approval. Your approval letter file needs to start with APPR_ for it to be accepted. Once you click submit, you cannot make any edits. This is final. Go back through the application, make sure all information is there and correct before you check certify and then click submit. You can only go back through your application by using the previous and save and next buttons. Only program directors can submit an application. This page will display after you click submit. It will display your application number and what program your application was for. To go back to your application to view it or print it, you will need to go to your applications in your profile and select the drop-down that can be seen in the right side of the image of this slide. Now, Program Director Cassidy Naval will take over to go over the differences between CNM and FNP and PA.
Good morning, everyone. My name is Cassidy Naval, the Program Officer for CNM. There are two key differences for CNM, FNP, and PA. The CNM application as a whole is identical to what Charles just presented, but the two key differences are on the program information page and the program expenditures and funding page. In the CNM program information page, you will see a question regarding if your program is expanding for the 25-26 academic year. If you are expanding and have been approved to expand by your accrediting or approval body, you will select yes. Please read those two statements with the checkboxes next to them to verify. Both checkboxes must be clicked in order for you to apply for expansion. The second difference between CNM and FNP and PA applications, if you are expanding, will be the expansion midwifery expansion slot requested drop-down. That is where you can request up to 3 expansion slots for your program. Just like with FNP and PA, you will also see the total expenditures for your program. This will be all expenditures made in the academic year 24-25 for your CNM program. So now we're going to go into the scoring for all 3 applications. All of their scoring and the methodology for scoring is the same, so there's no difference there. So this is the new criteria for FNP, PA, and CNM. There's going to be a total of 75 points for this application cycle. We are going to be looking at criteria 1, % of graduates in areas of unmet need, 25 points. % of main training sites in areas of unmet need, up to 5 training sites with the most cumulative hours at 25 points, and the average pair mix of main training sites up to 5 training sites with the most cumulative hours at 25 points. So this is an example of how we calculate and score each of the 3 criteria. So this is going to be for one program. So criteria 1, this program has 50 graduates. 20 of their graduates are practicing in areas of unmet need, and we make a percentage. That means they have 40% of their graduates practicing in areas of unmet need. From there, we will use the percentage, multiply it by the total number of points, 25, to equal the points that you're going to receive for that criteria, so 10. It's going to be similar for the next criteria 2. We're going to take the number of training sites provided, how many training sites are in areas of unmet need, and then we're going to multiply that by a total number of points. So this program is going to get 18.75 points. And then the last criteria that you are going to be scored on is the average pair mix of main training sites. So for this example, this program has 3 training sites. Each of their totals of percentage for Medicare, Medi-Cal recipients and uninsured patients are going to be totaled. And then those 3 training site percentages will be averaged and multiplied by 25 to receive their point scoring for this particular criteria. all three of those scores will be put together, and you will get that final point, 44.75 points out of 75. And I think I'm going to hand it off to Chris to start off our Q&A.
All right, thank you so much, Castany. As you can see, our team has put in a lot of hard work into this program, and we're excited that you've joined us today to learn more. We're going to switch to our Q&A session. In the menu bar at the top of your screen, you can find the button to access the chat feature where you can type your questions in the chat. We're going to do our best to answer all of the questions that we get today, and we've got plenty of time here left, so we should be able to get to everybody's questions. We do ask that if you have really specific questions, or if we are unable to get your questions today, or if you remember one tomorrow and you say, I wish I had asked this, go ahead and email us at songbrown@hci.ca.gov, and we can assist you there. And you will find that information posted in the chat already, pinned to the top. You can see the resources, the Song Brown page, the FNPPA page, the CNM page, the grant guide, the funding portal. All of the submission dates and our email address are all there. We'll make sure that we post that a couple times as well. So let's go ahead and open up questions in the chat. And you guys can start asking any questions you have about the program right now. And Castany and Charles will be here to help us answer those questions. Give everybody a minute to think of any questions they have. Make sure that we are able to access the chat. If you could all give me a thumbs up if you're able to find the chat button, and that would help us know that everything's working on that side. Fantastic. See your thumbs up. Thank you for that. All right. First question. Will funding for the PA programs be for clinical again, or are we able to use the funds for first years? Thank you for that question, Rasha.
You will be able to use the funds for first years.
Fantastic. Thank you, Charles. Or for both?
Yes, for both.
All right. Thank you for that clarification. What other questions do you all have for us today?
I will expand a little bit on the answer for that question. So Song Brown grant funds can be used for anything related to the direct education and training of your students. We do ask for first years. That is how we, those are the students that we will, the student slots, that we will cover. So for example, for FNP, and CNM, you get a 14 maximum slots. And then so any expenditures for those 14 students that correlates to their direct education and training will be allowed with Song Brown. And if you have any questions, like if you were to be awarded and you have any questions regarding an expenditure, you could always reach out to us using that Song Brown email, and we'll be happy to clarify those things for you as well.
That additional clarification, Castany. All right, other questions that we have today. All right, Heidi asks, can the funding be used to pay preceptors?
Yes, the funding can be used to pay preceptors.
All right, and Rasha says, before it was only for one of the groups, not both, just want to make sure it's okay to use for both.
Can you clarify what you mean by clinical? Just so I can make sure we are answering it to the best of our ability. Yes, so we do allow preceptor stipends using Song Brown grant funds. So as long as it's direct education and training of your students.
Rasha, thank you for that clarification. Just a reminder, the Early submission date is September 9th at 3 p.m. We encourage you all to take advantage of that. It's a great way to make sure that your application has everything it needs before the final deadline on September 24th. Let's see, another question. Any clinical sites, or does it have to be in an MUA, for example?
It could be for any of your training sites that your students use.
Another great addition to the conversation there. Thank you, Rasha.
Just to clarify, however, for the specific application, we are only looking for your training sites with the most cumulative hours in general. So wherever your students spend the most time training in the past academic year, that is the training site that we're looking for the actual application.
We have plenty of time today, so we're in no hurry to get through questions. If you have anything that you need help with, application specific, we've got time to go through any issues that you may be having. Just a reminder too that this webinar is going to be repeated again this afternoon. So if you have coworkers that you feel would benefit from it, please have them join this afternoon session, and we will also be recording both sessions and putting them on our webpage. All right, Julie asks, I'm a brand new PD, so here to learn. Thank you. Fantastic, Julie. We're so glad that you're here with us today. And Jennifer asks, is payer mix info available in any database, or is that only able to come from the sites themselves?
As far as we know, it's only able to come from the sites themselves. It's not going to be available online.
Question, Jennifer. Thank you. Heidi asks, can we use the funding to pay clinical sites? Some of the clinical sites are asking for fees for clinical placements.
No, you can only pay for the preceptors, not the fees for clinical placement.
Thank you for that question, Heidi. All right, Fatima asks, can you please share more details about early submission review? Can we edit our application after early submission review?
Yes, you can edit your application after early submission to make some revisions to it.
So we review them. We about a week. We review them, and then we give you feedback on the things that maybe you're missing, or we notice, like if you put in filler information, for example, and we see that you forgot to take it out, then we will let you know. So we will email you a list of feedback that we have, and then we will reopen your application so you'll have an opportunity to make those edits, and then send it back for final submission.
That's absolutely why we encourage everybody to take advantage of that great opportunity. All right, other questions today. Any questions about the program, about using the application online? Questions about what happens after you submit your application? And again, if you think of a question tomorrow and say, man, I wish I had asked that, please email us at songbrown@hci.ca.gov, and our team will be happy to answer any questions that you have after the webinar. Julie asks, what is the turnaround time for being notified of acceptance or not?
Awards are anticipated to be posted this year by January of 26. We will make those formal announcements as they come. But yeah, anticipated at the moment, January of 2026.
Thank you, Julie, for that question. Heidi, thanks for joining us. We appreciate your questions today. One of the things we really encourage you to do, if you haven't yet, is to make sure that you go download the grant guide and read through it. Make sure that you have read through the TA guide and all of the resources. It's going to really make sure that you have all of the information that you need.
Yeah, and to piggyback off of that, Chris, the technical assistance guide resource is going to be similar to the webinar where there is a page-by-page walkthrough of the application. So if you've never seen the application before and you want to see what kind of information we're looking for, the technical assistance guide will have that information for you. All of those screenshots in the slides are directly from the application, so you'll be able to kind of have a preview of what it's going to look like before you even open one.
Thank you, Cassidy. We'll give about another minute for you to think of any questions that you have and get them in the chat. We also have another opportunity again this afternoon. We start that one at 1 o'clock today. And so if you think of another question or you have a coworker that you want to join this information and get this information, please join us today at 1 o'clock. Again, it takes about 7 to 10 business days for us to get the recording online. We do have to make it ADA accessible, make sure that it has captions and all of that. So we will get that posted on our website. Again, 7 to 10 business days, we'll have that up there for both sessions. I'll give about 30 more seconds here if anybody has any last minute questions that they want to get in today before we conclude the webinar. Marie, thank you for joining us today. Gabrielle says, can we have the link to the website where we can find the recordings, please? Yeah, the recordings will be on the page for each of the program pages. You'll find that on the FNP PA page. You will find the recordings on the CNM page as well. And so we will have those recordings posted in the resource section for each of those. And so looks like all of the questions we've got today. We really appreciate your participation with us in this Q&A session. Again, if you didn't get your questions answered or you think of one later, please email us at songbrown@hci.ca.gov. We do appreciate you all joining us to learn more about the Song Brown FNP-PA and the CNM program. We're excited to be able to offer it as part of our health workforce development programs and efforts here at HCAI. It's just one of many programs that we have. We would love for you to go check out our website and see all of the other resources that HCAI has. We would also love for you to follow us on your favorite social media platform. And if you're awarded, we would love to see you tag us as you begin to start your work with your programs. We'd love to see the great work that you're doing. Go ahead and post on social media and tag us with one of these hashtags, and we'll be able to join with you online in celebrating the work that you're doing. One of the best ways for you to be in touch with us and see what's going on, stay up to date, is to sign up for a monthly newsletter. If you haven't done that yet, you can go to this link at the top here. You can also find it at the subscribe button on our website. And what you want to make sure that you do is sign up. When you sign up, click on any of the health workforce related topics, and you will be added to our monthly newsletter list where we update you on all of the things workforce related here at HCAI. You can always contact us with phone or, again, the email that I've mentioned before. Want to make sure that I mention one last time the September 9th early submission date and the September 24th at 3 p.m. Final application closes, so don't wait to get those applications in. With that, thank you so much for attending. This is the conclusion of today's webinar. We hope you have a wonderful day.